But indeed, it is a worrying situation. And remember, in parts of Africa, we're in our winter months. And in our colleagues from our regional office were reminding us that in some countries there's snow on the ground, and so people are spending more time indoors as opposed to outdoors. And we need to ensure when that happens we have good ventilation indoors, that masks are worn, that masks are provided, that they are worn appropriately over the nose and the mouth, they have the right filtration, that our hands are clean so that when we put on and we take off that mask that we're not inadvertently infecting ourselves, that we clean our hands. We use all of those measures. But 18 months into a pandemic, it's incredibly difficult to sustain these measures. And this is why vaccination and vaccines reaching those most at risk, particularly across the continent, is critical. And it's now that we need these because people are dying now. So we are working through our regional offices and our country offices to provide the best support that we can, and providing the supplies, ensuring that our health workers are protected, are cared for, are operating in safe working environments, that oxygen and the related supplies, medical oxygen and the related supplies are reaching those most in need, that the dexamethasone is reaching those who are most in need, used for the right patients who are severe and critical at the right doses and for the right amount of time. So it's a combination of factors that are necessary to be able to support countries that are indeed seeing some quite worrying signs of increasing transmission.
Yeah, and may I just add that it's when you look, and any of you can look on our website and see the numbers. When you see the absolute numbers, it doesn't appear that our African region is in necessarily bad shape. It's only in the last week represents just over 5% of global cases and over 2.2% of global deaths. But given what Maria said about underdiagnosis on the continent, it's trajectory that's very, very concerning. And in the last week, we've seen over 100% increases in Namibia and Sierra Leone and Liberia, in Rwanda and Zambia and Zimbabwe and Malawi and Lesotho, in Congo and South Sudan. We've seen between 50 and 100% increase in cases in places like Mozambique, in Cote d'Ivoire. So this phenomenon, and in South Africa and in Uganda and in many of these countries. So this is a phenomenon occurring across the continent. As Maria said, the factors driving it may be seasonal in southern Africa. There may be other factors driving it elsewhere. But the brutal reality is that in an era of multiple variants, with increased transmissibility, potentially increased impact, we have left vast swathes of the population and the vulnerable population in Africa unprotected by vaccines, in a context where health systems are already weak. That's the reality. And this is the consequence of the current unfair distribution of vaccines. If we had been distributing vaccines fairly and equitably, we may by now have protected those people most vulnerable on the African continent, and we simply have not done that. And whatever the factors that are driving this, be it exhaustion in the system, be it the fact that people have to go back to work, be it seasonal, the reality is that the population that needs to be protected is not. And we have the same concerns in African countries in refugee situations at the moment. We've seen before the presumption that the next wave will be the same as the previous wave. I think every country has learned that every wave is unique, because it depends on the season, it depends on the health system, it depends on the variant, it depends on the intensity of transmission. So how the virus epidemic manifests itself on each wave has been different in every country. So to assume that the next wave in Africa is just going to be a small passing shower and will not be a storm, I think is very, very premature. And I think we have to really take what's happening on the African continent very, very seriously. Our African Regional Office, led by Chidi Moeti, Dr. Tedros, and others, have constantly spoken about this inequity. And we're going to pay a heavy price for that inequity in the coming weeks and months. We hope not. I dearly hope that is not the case. But the trajectory and the direction of travel and the point of impact of this pandemic is switching around the world. I've said that before. And it is very clear that there are strong signals coming from Africa and from the African region of WHO that the disease is on the rise, the impact is rising, and we need to move quickly to support those systems and get the most vulnerable people vaccinated in Africa.
Thank you very much. I see that Dr. Aylward would like to add something to this question. Dr. Aylward.
Thank you very much, Tarek. It was on the specific question that was asked about one specific vaccine. Here you asked about in the Africa context. And of course, there's often questions and hesitancy about vaccines in general or classes of vaccine and sometimes specific vaccines. And that's the reason that there's 2 or 3 key things that are being done to try and address that with the rollout of the vaccines, because all of the vaccines that we recommend that WHO has given emergency use listing to, we've looked at very carefully and can speak to their safety, efficacy, quality assurance, and their programmatic utility. So the key things we're trying to do is get the accurate information out there so that people are making evidence and accurate-based personal decisions as well as population-level decisions. The second thing that we're working toward is ensure that they're getting the information from the right channels through leaders, local leaders, other leaders, religious leaders that they know and they respect and they trust to provide that information. And of course, this comes back to the role of the press, which is just so important in helping ensure there is accurate information about these vaccines, because all of these products, the benefits far exceed the risks given the gravity of this disease and the waves of disease that we're seeing. And we're going to need a concentrated approach to help ensure people understand those realities and get themselves protected as rapidly and quickly as possible. But to the point Mike makes, and that Dr. Tedros has spoken to again and again, the big problem now is not hesitancy anywhere in Africa, many of the places we serve through COVAX, it's lack of vaccine. You can't hesitate to take something that's not available. Let's get the vaccines out there, get them available to people to help get the coverage rates up. That's the crucial thing at this point.
Thank you very much, Dr. Aylward. And with this, we will conclude this press briefing. As always, we will send the audio file later in the evening, and transcript will be posted at our website tomorrow. With this, I wish you a nice weekend, and I give the floor to Dr. Tedros for his closing remarks.
Yeah, thank you, Tariq, and thank you to all who have joined today, and see you in our upcoming presser. Thank you. Bye-bye.